cells, mesenchymal stem cells, the magnificent mesenchymal stem cells. They can become all three germ layers of cells, so they can heal any tissue in the body. They're universal donor cells. And this is what they look like on electron microscopy. They hug the blood vessels, okay? And they're available throughout the body for that reason, because they're right there. Every part of your body has blood vessels, so they're sitting there. Plus, they're stored in the liver, and they're ready to go out when they need, and they're in other places too. All those things I just told you, you can't have it unless you go overseas, because the FDA won't allow it. They won't allow you to take the cells out of fat, which you can get a lot of mesenchymal stem cells out of it. They'll let us take the fat out, but they won't let us melt the fat with collagenase so that the stem cells drop out and we can put them intravenously. They won't let us take even your own bone marrow and expand the mesenchymal stem cells. And since there's not enough to treat you in there, then you can't do it. But this is the placenta, okay? And you see that there's this thing called the amniotic membrane. It looks like cellophane, okay? And for decades, they'll put this amniotic membrane on corneas that are destroyed and regrow the corneal tissue. They put it on burn patients and regrow the skin. They put it on diabetic ulcers that won't heal, and the thing heals. And the reason for this is that the greatest, most powerful, most wonderful mesenchymal stem cell is in it. And they can't disallow it because it's been used for 3 decades. What are you going to do? The gig would be up. You'd all realize the FDA's not on your side if they say, well, we're going to pull it back because it has stem cells in it. Just can't do it, okay? Well, now they've figured out that you can morselize it and put it in and let it make its own cytokine juice, and now you got an injectable, powerful mesenchymal stem cells. You can't put it IV because they're too big and you'll cause clots. It's bad. But you can put it in joints. And that's what I think you're going to see coming in the next year or two. This has gotten by the FDA. Now here's a peer-reviewed article that shows that the cartilage on the right has been destroyed. Okay? This is an animal study. They put morselized the amniotic membrane product through a needle into the joint, and it completely regrew in 4 months. And that's the completely regrown. And this will be excellent at avoiding surgery with osteoarthritis, degenerative arthritis, to regrow that cartilage. And we can put needles in joints very easy to do that with fluoroscopic control. We can put it in the shoulder, we can put it in the knee, and we can put it in the hip or wherever we want to put it. All right, there it is.